So, unlike Mike and AJ, I did an internship. I based my thesis on the risk of a multiple gestation pregnancy resulting from infertility treatment. So I spent more than 200 hours at the Center for Advanced Reproductive Medicine and Fertility in Edison, New Jersey. My function was to basically shadow the clinical staff, follow them, follow the doctors, and see everything that encompasses the infertility world. I also discussed procedures and treatment options with patients, and current patients and prospective patients. As I mentioned before, my internship gave me the insight into the world of infertility. I based my experience writing my thesis because I believe many couples don't realize the risks that multiple gestations have when they are going through the process and through infertility treatment. Each year, over 1.5 million women seek infertility care. They can range from ages of 15 to 44 years old. These treatment options range from in vitro fertilization, also known as IVF, through intrauterine insemination, which is known as IUI. Due to the increased use of fertility medication, the number of multiple gestations has increased by 70% since 1980. These medications manipulate the body into producing more follicles than it naturally would in a woman's cycle. Now in this picture, I don't know if you can see, there's 4 pink dots. Those are used under ultrasound guidance. This is a picture of an ovary, and the 4 pink dots measure a follicle. If you can see the 4 pink dots, that shows a mature follicle. A mature follicle is usually 16 to 20 millimeters large. And by using the fertility medications, we hope to get several follicles, and under anesthesia, we retrieve the eggs via aspiration. Due to the financial burdens of these costly treatments, many couples will resort to increasing implantation. So many will put back 3 or 4 when the regulations are only 1 or 2. They hope to avoid having to go through another cycle, but most of the time this will lead to a multiple gestation pregnancy. Over 98% of women who are pregnant with multiple gestations or multiple fetuses, which is typically 3 or more, will have serious health complications and risks. They'll need serious, rigorous prenatal care, and they also might need antenatal hospitalization. Like all of you know, in California in 2009, a single unemployed woman gave birth to live octuplets, and the media gave her the name Octomom. She remained in the hospital for 7 weeks prior to giving birth. This is her before. And then this is the babies after delivery, and her in the bottom right-hand corner during a Dateline interview. If a third of triplets are born extremely premature, are 12 times more likely to die during the first year of life than singletons, one can imagine how high of a risk multiples can have on themselves and the mother carrying them. The good news is that there are several different types of treatment options available for them and the babies. The first is a procedure known as multi-fetal pregnancy reduction, which is selective reduction of the fetuses, so it will reduce it from a multi-gestation pregnancy down to a single or double pregnancy. The MFPR procedure is typically done between the 10th and 12th week of gestation. So in conclusion, I emphasize what I say to my patients when we're talking to them about all the different types of procedures and options. First, the human body is really only built to carry 1 or 2 gestations, not more than that. Due to financial issues, many couples again will resort to implanting more embryos, but they fail to realize for the future they're worried about now. In the future, they have to pay for school and books and health and covering and things like that. So they fail to look at the future where it might end up costing them more than going through a whole nother cycle. And third, those who become pregnant with multiples seriously need to consider the multi-fetal pregnancy reduction, because otherwise they're at risk for losing their own life and losing the whole pregnancy altogether. At our office, we had a woman who was pregnant with triplets, and she lost all 3 of them at 32 weeks, so you can lose them at any time. I'd like to thank Dr. Gregory Corsan, Renee Curlin, Kevin Kessler, and Christine Angeles Bojar who work at the office, who help me write help me with the articles, let me shadow them, answer all my thousands of questions. Dr. Zoltan Fulop, who is my advisor in helping me write this thesis. Dr. Amini Morthy and Professor Linda Raths for all the help and support during this. Any questions?
I have a question. When they do the fetal rejection, how do they choose which ones are the strongest?
They do it under ultrasound guidance, and they just take a needle and inject potassium chloride into a fetal heart, which will stop it from beating. But there are a lot of risks. Like, a risk could be hitting another fetus by accident or poking it or killing. Like, you could lose the whole pregnancy while you're doing the procedure. It's not guaranteed that you only will reduce like sextuplets down to, you know, twins. So you could lose the whole thing, but you don't. There's not like a specific like I'm gonna choose that one. It's more of whichever one I guess is there. Anyone else?
Really interesting ethical issues and things that you bring up. Do you think that that people in general in the press are beginning to talk about these ethical issues? I mean, do you think people?
I think so. I think so because of the John and Kate whole fiasco with the show, with Octomom, and she already had 6 or 7 kids before she even had the octuplets. So it's a whole lot of ethical, it's a whole lot of the medical regulations and things like that, and a lot of people are starting to question if there are regulations, and there are. But the office told me that they check them, like there's a division of the health department where you have to send all your statistics, but many of the places won't get shut down because twins are okay, but if they start to see triplets or quadruplets or more than that, then they get like a warning, and then the whole place will get shut down if they have too many, because you're really only aiming for 1. Twins are okay, but anything over that and more than a normal amount is not good. Anyone else?
Besides that hospital where you went to for the fetal reduction, that procedure, what other centers are doing this procedure?
I'm not sure. I know at our place we don't do it. I know that high-risk OBs, OBGYNs, they do it, and in hospitals, but I don't think it could really be done in a hospital, in an office setting. It has to be done
In a hospital, because
yeah.
it's very risky.
Yeah, it's extremely risky, and it's obviously done under anesthesia. Like, for our patients, when they do the IVF, it's under, like, local, so it's not as bad, but I think for that procedure, you go under general, because it's injecting potassium chloride. Anyone else?
I'm curious what you're doing after you graduate.
Actually, I don't know. I took the MCAT, but I didn't do as well as I wanted, so I'm trying to get into an accelerated nursing program and then get my doctorate in nursing, and either go into this field or go into pediatric oncology. So we'll see.
Technically you're terminating a pregnancy, but is it looked at as a mother or a parent choosing to terminate a pregnancy, or is it looked at as a risk to the mother's health?
A risk to the mother's health, because they could have postpartum hemorrhage, like everything. They could have gestational diabetes. Everything's more increased, especially with the number of multiples. So they really, like, the doctors really stress like that high risk, like doing the reduction, because then the risks are much lower. Even though there'll still be risks, and during this procedure it'll reduce the pregnancy. You could lose the whole pregnancy, you could damage the other children, but it still will benefit them, like it'll help the mother. Because you can always make more kids, you can't make another you. Anyone else?